Distinguished Alumni Award nominees. Marianne Chavez, Nurse Practitioner, University of New Mexico, Para los Niños, Department of Psychiatry, Adobe Clinic. Marianne is a pillar of the nursing community. Throughout her career, she has continued to serve underserved populations, having worked both the First Choice Clinic in Belen, New Mexico, and La Bella Vida Clinic as a family nurse practitioner. In addition, Marianne also serves as a trainer, consultant, and instructor within the New Mexico Coalition of Sexual Assault statewide programs. She participates in and initiated peer review for sexual assault nurse examiner rule partners. Marianne has precepted individuals regularly within the community. She is a strong preceptor, always giving research evidence-based guidance. She has served as an instructor on several occasions with the New Mexico Coalition. Robin Dow Chavez, Executive Director, Red Willow Hospice. Robin is known as a leader and a mentor who cares for her community. She recently started her own community-based hospice, which focuses on providing care to rural areas of northern New Mexico where access is limited. She is passionate about supporting the needs of New Mexicans, emphasizing the need for access to quality health care for Indigenous people of Taos Pueblo. Robin also understands the importance of sharing her knowledge with others. She has been an active preceptor for UNM Taos in the hospital setting, as well as for students in other programs. She most recently precepted a BSN student in her hospice agency that she founded. Robin demonstrates that nursing can pave the way clinically and professionally, and that nurses have the capacity to promote access to care through their ventures. Elizabeth Victoria Claiborne, Clinical Nurse Specialist, Queen of the Valley Medical Center. Lisa is a lifelong learner. She reads recent literature and attends academic meetings to keep up to date on the latest science and treatment techniques. She then relays the knowledge to her colleagues to ensure the best outcome for her patients. She regularly consults with the biomedical departments and equipment vendors, working as a liaison between the physicians and staff. Lisa is active in teaching other nurses, students, and related health personnel about cardiology conductive abnormalities and diseases. She has participated in the Hospital Nursing Board and has helped set up new electrophysiology labs. She was a volunteer vaccinator during the height of the COVID-19 pandemic and worked countless hours to ensure the safety of our community. She has also worked as a volunteer RN in Guatemala. Sandra Dodge, retired. Sandra has dedicated her career to public health, having joined the United States Public Health Services. Her efforts include collaboration with local, tribal, and state health representatives to implement a school-based health and exercise program. She's coordinated with other health professionals and policymakers to implement programs that alleviate some health disparities for Indigenous women and women of color. She also worked with other clinicians to develop much-needed research on domestic violence within Indigenous communities and lay the groundwork for the inclusion of advanced practice nurse clinicians to serve on national committees with the agency's physicians cohort. She was active in epidemiological investigations of infectious diseases in the service area, immunization programs, screening and monitoring for sexually transmitted infections. She also conducted home visits for prenatal and postpartum at-risk families and coordinated care for those with diabetes and the elderly. Sandra worked to develop community-based programs and health initiatives that included implementing weekly visits at a detention facility, as well as a school-based clinic. While working at the Chinle Comprehensive Healthcare Facility, Sandra revived the dormant sexual assault nurse examiner program and began the process of getting other nurses and APRNs trained. In addition to all of this, Sandra has served as a mentor to newly graduated advanced practice nurses from the University of New Mexico, Arizona State University, and the University of Arizona, as well as Frontier School of Nursing. Susan Donlon, Director of Public Health Nursing, Indian Health Services, Jicarilla Service Unit, Dulce Health Center. Susan has led an incredible, varied, and distinguished nursing career. Her achievements are numerous, and she has proven herself to be an exemplary leader in her chosen profession. Specifically, she has served as leader, provider, and director of public health services for over 25 years. She has been formally recognized on numerous occasions for her initiative in creating and implementing sound public health practices. In addition to her distinguished service in public health nursing, Susan simultaneously serves as an officer in the U.S. Navy Nurse Corps. She was deployed on several U.S.-based humanitarian missions and served a year deployed into the NATO Combat Hospital in Kandahar, Afghanistan, in support of the U.S. mission in the war with Afghanistan. Susan has been acknowledged as a mentor to those under her supervision. Several individuals in her community were led to pursue nursing careers by Susan's support, example, and encouragement. Susan Feldman Foster, Quality Consultant, Hospice de Valle. Susan is a leader in the local, state, and national nursing communities. Her clinical practice focuses primarily on serving the underserved in South Central Colorado through maternal child health programs, children with special health care needs, migrant farmers health services, and hospice and palliative care. Susan has served on the Colorado Nurses Association Board as the chair of the Healthcare for All Committee. She contributed to Colorado's Blue Ribbon Commission on Healthcare Reform, where local and statewide forums were provided to educate community members on healthcare reform. She was presented with CNA's Distinguished Contribution Award for her service on behalf of Access to Healthcare in 2006. She has also served as a delegate to the American Nurses Association House of Delegates, and she was elected to ANA's Congress on Nursing Practice and Economics, where she served her 4-year term with the additional role of chairing its Access to Healthcare work group. This group drafted the background paper which led to the adoption of the ANA position statement, Nursing Roles and Responsibilities in Providing Care and Support to End of Life. Susan has served as an adjunct outreach faculty supporting RN to BSN students for UNM. She was also a clinician preceptor for the FNP program at UNM and the University of Colorado Health Sciences Center. In addition, she continues to mentor nursing students and colleagues through her role as quality consultant. Karen Hurley, Surgical Services RN, Dell Seton Medical Center at the University of Texas. Karen's leadership inspires others in nursing. She is highly regarded within the organization. She uses her clinical expertise, her curiosity in solving problems, and her interest in the operational impact on care to drive excellence and success in all of her work. During the worst of the pandemic, Karen led her pre-admissions testing team in all aspects of COVID-19 for all surgical patients before surgery, including organizing the technology, organizing the results of callback processes, operationalizing the drive-through testing process, and anticipating process changes relative to community prevalence and testing demand. Under Karen's leadership, the team performed over 3,500 COVID-19 tests on associates and providers and countless more tests on their patients. Karen's interest in COVID-19 also led her into research. She became a research nurse for an immunology-focused research project with a neurology clinician investigator. Lizette Maria Infante, Nurse Case Manager, University of New Mexico, Truman Health Services. Lizette has been described as one of the most dedicated nurses at UNM Truman's Health Services. An advocate for nurses, she led the team to assume responsibility for duties that providers were performing but really should have been done by the nurses. This enabled the nurses to use more of their skills and talents. Lizette works in one of the most difficult fields of medicine, HIV care. Not only does she work the long, grueling hours of a nurse, treating traumatized patients with kindness and understanding, but she also works to combat the stigma and outright hatred from the general population. Through avid conversation and education, she normalizes HIV diagnoses and treatment. She is part of the Ending HIV Epidemic in the U.S. by 2030 by providing excellent care and information. She helps her patients maintain undetectable virus loads by encouraging them to adhere to the medication and maintain their appointments. She is not afraid to have those hard conversations with community members. Frances Kathleen Lopez Bushnell, nurse practitioner, Turning Point Recovery Center and On-Call Health Center. Kathy influences the advancement of nursing through her expertise as a clinical nurse researcher. She supports other nurses in advancing their practice through evidence-based patient care. She served in the New Mexico Office Institutional Review Board as a nurse researcher for the nurses at UNM hospitals. Kathy distinguishes herself as a primary care clinician with approximately 58 years of experience. She also serves as a clinical faculty for many nursing and nurse practitioner students. Kathy also gives back to the community in many ways, including caring for the homeless and underserved. She serves on the board of Health Leadership High School and works with the students, faculty, and administration to interest high school students to becoming nurses and enter the healthcare field. Kathy helps high school students with clinical placements and information on how to enter the nursing education system to become nurses. Deborah O'Sullivan, family advocate nurse, United States Air Force. As the wife of an Air Force veteran, Deborah's career was often at the mercy of government orders. She worked as a nurse, a nursing instructor at a community college, and a nursing support for school district in Pennsylvania. Deborah's work as a nurse practitioner has grown to support new families. She has even become a certified lactation consultant to assist in her support. She currently works for the new parent support program at Carrollton Air Force Base, conducting home visits to give expecting and new parents the support that they need. Additionally, her outreach on base has extended to hosting playgroups that provide young children the chance to play while giving their families materials to help around the holidays. Deborah recognizes the importance of training and maintaining competency in new trends and developments in the nursing world. While she is working at the Kirtland Air Force Base Clinic, she strives to keep current with the advances in new technology and techniques that nurses use to do their jobs. Stephanie Sanderson, Nurse Manager, Sharp Healthcare. Stephanie has worked as a bedside nurse, an ECMO nurse, a charge nurse, a clinical nurse specialist, and a unit director at UNM hospitals, where she has worked for 32 years before retiring to pursue her dream to work and live in Southern California. Stephanie served in the Master Teacher, Master Clinician role and partnered with the College of Nursing for nearly 15 years. She mentored thousands of nursing students along the way and ultimately supported them in being hired into the critical care areas. To this day, students from her past contact her to thank her for helping them throughout their careers. Stephanie has spoken at both local and national conferences to promote the role of critical care nurses. She has volunteered regularly at city-sponsored events, including and not limited to Project Heart Start, AACN volunteer activities, and serving families at the Ronald McDonald House. She has also spoken at community centers and churches to members of the community about the importance of advanced directives and estate planning. Stephanie remains passionate about assuring the profession moves forward. She continues to work full-time in a robust trauma ICU and worked tirelessly during the pandemic to maintain a safe and stable workforce. She is committed to lifelong learning and continues to seek out opportunities to be the best nurse and leader she can be. New Alumni Award nominees. Erin R. Beverly, Advanced Registered Nurse Practitioner, MHS. Erin is an exemplary provider and leader. She sets the bar for other colleagues and medical staff to follow with a steadfast and compassionate approach. She delivers healthcare in multiple facilities and is not shaken by the rigors of making difficult diagnoses, as well as relentlessly staying up to date despite the pandemic burden. Her ability to uncover an underlying pathology is second to none, while not breaking her stride during a busy clinical day. Other healthcare practitioners seek her out to take care of their medical needs, and they will travel to be seen by her. She is consistently looked to and asked for regular input from medical facility staff about policies, efficiencies, and potential venues to improve upon. She inspires young medical assistants to become providers when they showed aptitude. During the COVID-19 pandemic, Erin kept the entire staff up to date daily about best practices and several times corrected company-wide policies that conflicted with mandates. It's only because of her tenacity in wanting to practice the highest level of care that kept her clinics running smoothly and kept them open. Erin is working on several research projects. Most notably is her research on harness suspension stress, published in the Journal of Occupational and Environmental Medicine in 2019. This is the most in-depth research into the subject matter and is a pivotal paper regarding the pathogens of suspension stress. Brandon J. Holmes, Psych RN Outpatient 3, UNM Hospitals, ASAP admitting. Brandon has had to overcome obstacles in his life while rising above. He continues to grow within his professional self and has been unwavering. Not only is he determined to serve the patients that he works with, he is also committed to UNM's Addiction and Substance Abuse Program, SAP. Brandon listens intently to his patients with the understanding that every patient's needs are unique and that everyone comes from different backgrounds. He is currently studying for his certification in psychiatry because he is determined to grow as a nurse and gain new knowledge and tools to excel in his position in SAP. Even though he is young, he is the lead within his unit, and he is the only member of his unit that works full-time. He is eager to learn from more experienced individuals and respects all the knowledge of those who have worked in the psychiatric and addiction nursing for a long time. Brandon was awarded the Distinguished Nurse in his unit in 2020. Outstanding Undergraduate Preceptor Award nominees. Kayla Galvin, Registered Nurse, UNM Hospitals, Newborn ICU. As a preceptor, Kayla is very knowledgeable and approachable. She not only goes out of her way to teach nursing students, but also the new nurses on the unit and to guide those who need help. Her communication with family is remarkable, and she understands how to talk to the parents and understand their concerns and advocate for her patients. A lot of the team, including respiratory therapists and nurse practitioners, will listen to her and understand that she always has the patient's best interest at heart. She demonstrates the skills of a leader and one who can keep organized while implementing the best plan of care for newborns. Kayla wants her students to try new skills. She uses the Teach Back method and also allows students to chart on patients. She goes over whatever they need to learn more about. Alex Garnett, Registered Nurse, Heart Hospital of New Mexico at Loveless Medical Center. Alex goes above and beyond to be a phenomenal preceptor. From the start of Capstone Clinical Rotation, he communicates his roles and responsibilities, as well as maps out a clear guideline for how he plans to help students become better nurses, as well as how the student can feel confident in their abilities. Alex not only helps students better solidify their understanding of concepts, but he also pushes them to learn about new medications, procedures, and medical diagnosis. All students could benefit from a knowledgeable preceptor like Alex. Julia A. Jaramillo Quintana, RN Inpatient 3, UNM Hospitals, Intermediate Care Nursery. Julia has a great passion for teaching and passing down all the wisdom she has gained in her years at the Intermediate Care Nursery. She takes the time to explain each small aspect of what it's like working in ICN and how to take care of the neonates to her students. She often matches their excitement to learn. During her breaks, she takes time to teach students specialized techniques like how to tape infants' IVs to their heads. She also teaches students how to be cognizant of the tasks that need to be done and the time frame they have to do them in. Paul Langwood, Registered Nurse, Presbyterian Rest Hospital, Oncology Unit. Paul has an intense desire to teach and help others. Passionate about the field of nursing, he performs his nursing responsibilities with expertise, compassion, thoroughness, and consideration. Paul is revered by his coworkers for his skills and uncanny ability to solve difficult nursing problems and calm difficult patients. He is an incredibly hard worker and a tireless patient advocate. Not only is he enthusiastic about being a nurse himself, but also about sharing his knowledge with others. Paul takes extra time and effort to teach students clinical skills with hands-on experience and the reasons for his actions, along with the critical thinking involved in his decision-making. Providing practical examples, he then guides students to perform the tasks on their own, even going so far as to assist students on how to cope with the death of a patient. Paul is always the first person to offer assistance to patients and staff alike. He also gives his free time to helping care for the needs of veterans in our community. Paul is a wonderful nurse who has great empathy and compassion for his patients. He provides an excellent example of what a nurse should be. Brittany Sanchez, Critical Care Registered Nurse, UNM Hospitals, Medical Cardiac ICU. Brittany prides herself on being a competent nurse, but always acknowledges that she does not know everything. She goes above and beyond to find an answer for her students to make sure they learn. Brittany provides her students with multiple learning opportunities and is very supportive when teaching. She shows students how to take initiative and how to be efficient. She is always kind and more than happy to teach when a student is unsure of a process. Outstanding Graduate Preceptor Award nominees. Crystal D. Apodaca, Nurse Practitioner Hospitalist and Assistant Professor, University of New Mexico, Department of Internal Medicine. Crystal is an essential educator for the UNM Hospitalist Group, constantly precepting both NP students and NP fellows. The ability to oversee multiple trainees at one time is both remarkable and necessary for the hospital's current needs. She is always dependable for the College of Nursing and also remains a key resource for her fellow APPs, always quick to help with clinical and administrative questions. Crystal's calm and compassionate demeanor is always on display, whether dealing with patients, students, or colleagues. She is in a constant mode of teaching and manages to include time for case studies and education that directly apply to the day's patients. This process allows for the learner to apply study material to their current patients in a manner that helps solidify their knowledge base. She is very consistent in holding daily feedback sessions to allow for necessary or desired changes to the daily routine, ensuring that every learner has the best experience possible. Donna M. Dinich, Supervisory APN, Nurse Midwife, Northern Navajo Medical Center. Donna is an inspiration to work with, an upstanding community member, and a fierce advocate for women's health. She has a passion for providing fair and equitable care to the community and works hard to collaborate with everyone. There is a great sense of respect and accountability when it comes to both Donna and her team. She is incredibly thorough and efficient with her work and holds those around her to higher standards of care. Donna pushes students to be better practitioners each step of the way, teaching them how to use and manage their time carefully and the importance of staying organized while still performing trauma-informed care and partnering with the patient to cater care to them as individuals. She shares her own experiences to help students have a better understanding of the history, culture, and strength of Indigenous communities. Donna distinguishes herself through her clinical practice through her love of community. She works hard to go the extra mile for her patients, balancing patient quality time with her strenuous caseload. Knowing the individualized care she provides and the sheer volume of community members she cares for each day is amazing. Donna participates in staff meetings, applies for a fellowship, and volunteers for a Women's Day walk event while monitoring her students' growth and skills. She does so all with the balance of work and family life as a wife and a foster mom. Her colleagues all feel that Donna has good leadership skills and is a wealth of knowledge and wisdom. Lisa A. Lucero, Certified Nurse Practitioner, Renal Medical Associates. Lisa enjoys challenges and embraces them. She is always actively seeking to learn new things, constantly reading current evidence and research and furthering her practice. She encouraged growth in her students as well. Lisa is patient and always willing to teach. She is kind in every patient interaction. She knows everything about all of her chronic patients as if they were family. Her bedside manner is impressive and inspiring. Valerie Parks, Nursing Operations Manager of Clinical Research Office, University of New Mexico, Comprehensive Cancer Center. Valerie is always encouraging staff to advance their professional careers. She identifies strengths in staff and encourages them to build upon those and grow in those areas. She believes in nursing and research and wants nothing more than to build great leaders for our future. Valerie is an excellent leader in all areas. She has many conversations with her students about her experiences as a leader and what she has learned from them, and what they can learn from them as well. She welcomes conversation that gives students knowledge and allows them to grow. Aria Sanders, Family Nurse Practitioner, El Centro Family Health. As a fellow UNM College of Nursing alumna, Aria precepts family nurse practitioner students in a way that puts their learning at the forefront. She not only references the books currently being used in the classroom, but she also teaches how to better use the books to the student's advantage, along with other tools she has learned along the way. Aria always checks in with her students during the day to make sure they're doing okay and available for questions. She goes out of her way to introduce students to the staff, making sure to let other providers know that the student is available for learning from them as well. Despite Aria's busy schedule, she is more than willing to accommodate students and their complicated schedules. When a fellow practitioner for adults contracted COVID, she was able to take on the FNP student and help them complete their hours for the semester. Jennifer Stephenson, Psychiatric Mental Health Nurse Practitioner, University of New Mexico, Cimarron Clinic. Jennifer has been an exemplary preceptor. For a student nurse practitioner, it is both time-consuming and intimidating to learn the roles of an NP. Jennifer is patient and kind, and has an invaluable depth of knowledge from her academic and professional experiences. She uplifts her students and provides a supportive environment that allows her student to take on challenging tasks and grow professionally. She never boasts about her accomplishments and works hard to stay informed, even if it means reaching out for help. Her kindness and perseverance for growth are traits that inspire students to continue pursuing a lifelong journey of personal growth. David Apoko Asante, Nurse Practitioner, Presbyterian Medical Services, Farming Community Health Center. David is originally from Ghana, Africa. He has worked diligently to become a citizen of the United States and obtained his nursing degree. After earning his master's degree and a nurse practitioner license, he sought out a position in a rural community in New Mexico to serve underserved populations. He is currently obtaining his DNP, and despite his busy schedule, is always happy to help other nurses in their ongoing education. He has been patient and kind with sharing his knowledge and experience and makes everyone around him feel inspired to continue learning and improving. David allows the student to formulate and conduct assessments and collaborates in formulating a plan. He often will allow time for the student to have one-on-one time with the patient and then re-enters the room to provide direction and leadership, thus allowing the student to feel of value during their learning experience. The Daisy Award for Extraordinary Nursing Student nominees. Crystal Bustamante Cisneros. Crystal shows a natural inclination for compassion for her patients. She takes time to sit down with them and their families to not only discuss their medical needs and goals for progression, but also to learn about them as people. This is a skill that cannot be taught. Crystal can multitask and leave time to provide undivided attention to her patients. So many patients just want to be heard. This small notion of asking where they grew up, asking about their life, and what they enjoy most are all examples of gaining trust by making patients feel human in a world that has made us feel so divided. Crystal is compassionate and talented and demonstrates what nursing needs to be. She's always positive and looking for ways to improve care and the culture of nursing. She will be a huge building block in the foundation that will restabilize nursing practice. Brian Grover, Staff Nurse, New Mexico VA Healthcare System, Raymond G. Murphy Medical Center, Spinal Cord Injuries and Disorders Unit. Throughout his time in the graduate program, Brian has consistently sought ways to improve both patient experience as well as patient outcomes. He is committed to his patients and to finding the best approaches to improving their quality of life. Brian's capstone project, which is ongoing at the VA, seeks to integrate systems of care to improve staff morale along with the continuity of care for spinal cord injury patients. The purpose of the project is to better integrate inpatient, outpatient, telehealth, and home health to improve the patient and family experience, improve patient outcomes, and facilitate interdisciplinary collaboration, thus improving staff morale based on patient satisfaction and the knowledge that they are providing optimum quality care. Applying the theories of restorative justice and human becoming and directly paralleling them to actual experiences of his patients living with spinal cord injury, he has been able to advocate for transformative changes in the healthcare system in alignment with applied theory and improve patient health outcomes. Colleen O'Neill. Colleen has special attention to detail that cannot be taught. She looks at the small details and the root of the problem to make sure that her patient population is given the care most appropriate for them at that moment. Even behind her mask, the children and families can see the smile Colleen has when she interacts with them, and her work supports her love for the nursing profession behind the scenes too. While prepping charts, organizing pre-op handouts, or completing chart reviews, Colleen takes her time, and rest assured that no stone is left unturned in her tasks. She has a good grasp of the needs of the pediatric patients and their families, while at the same time caring for a critically ill in the ICU. She can reflect on her tasks and ask great questions to help her in patient care. Sophia Sager. Sophie exhibits commitment and compassion and care to patients and their families through mindfulness in her actions and words. Watching her interact with patients, you can see how the one-on-one therapeutic communication she uses has a positive effect on the overall experience. That builds a foundation of trust with the community and hospital care that will continue in future generations here in New Mexico. Sophie has a reputation for advocacy throughout her academic career. She has recently worked to start blood pressure clinics for both the geriatric education and health maintenance, as well as the breakthrough to nursing programs. Always taking the time to make sure everyone feels valued, heard, and respected, Sophie leads by example. Communities are impacted daily by Sophie in many positive ways. Though they may not know her name, they do know someone is looking out and speaking up for them. The Daisy Award for Extraordinary Nursing Faculty nominees. Nazat Ali, Senior Lecturer, University of New Mexico College of Nursing. It is clear, even in an online setting, that Nazat demonstrates a passion for nursing education. She incorporates current events, articles, and recent news stories into her classes as a means to draw her students into the subject. She gives meaningful and helpful feedback on assignments that has assisted students in other classes as well. Despite not living stateside, Nazat engages her students by doing live Zoom sessions, which are clearly in the middle of the night. She is unfazed by the time difference and always smiling and happy. She is approachable and easily reached. When a student has a question or a problem with an assignment, she has been fair and quick to respond and resolve the issue. Nazat treats her students with respect. She shows this by being timely in her responses to grading and communications. She is fair but kind. She shares and models her sense of curiosity, which leads students to also become curious and ask questions. Mary Pat Kuig, Associate Professor, Carter Fleck Endowed Professorship, Director, Center of Health Equity and Preparedness, University of New Mexico College of Nursing. Mary Pat helped develop collaborative working relationships with students by showing interest in their career paths, previous experience, and future aspirations. She brings in guest speakers to share about policy work and created space for everyone to speak and ask questions. When approached with a question about topics, she shares additional findings from her own review. Mary Pat shows patience with frequent communication about assignments. She is flexible in meeting times over Zoom that are outside her office hours to overcome student group work schedules. Mary Pat is responsive, available, and patient, and shows great humility with her students. After learning that some students were somewhat discouraged from finding most positions in nursing education preferred a PhD or DNP, Mary Pat found articles about MSN positions that might be options and posted them to articles of interest for review. She expanded assignments to include a role of analysis of education and administration so students could explore roles in alignment with their educational focus. Kristen M. Ostrom Nemcevich, Associate Professor, Clinical Educator, Interim Assistant Dean of Undergraduate Education, Executive Director of Undergraduate Programs, University of New Mexico College of Nursing. Kristen demonstrates a genuine interest in caring about her students' goals. She is often one of their biggest cheerleaders and sources of support. While mentoring a DNP student, Kristen encouraged them to submit an abstract for the Western Institute of Nursing, based on the student's DNP project. Up until that point, the student thought of the project as something that they wanted to do to help nurses in their unit and as a pathway to their DNP. They had never really thought it would be something worthy of a conference poster. To both of their delights, the abstract was accepted. Kristen even flew out to Portland to support the student on the day of the presentation. Kristen never hesitates to meet with her DNP students on weekends or evenings to help with their projects. When she gives constructive criticism, it comes from a place of love and caring. She has introduced her students to several faculty members that she believes would work well with them to advance their learning and goals to make the greatest impact in our community. Shmita Rashid, Associate Professor, University of New Mexico, Gallup. Shmita is full of nursing knowledge and is excited to share it with her students. She caters to her students' learning styles with notes, videos, and funny mnemonics. One time when learning a Parkinson's drug, she sang a Beyoncé song and the whole class remembered the name of the drug. Shmita goes the extra mile for her students. After back-to-back exams, she brought the class snacks because she didn't want any of her students to go hungry. She always shows integrity in every interaction she's involved in. She's also very patient. This semester, she saw that her previous students needed help in a class she was not teaching. She gave them a mini lesson so they could understand the material better. During class, she will also ask how well the students know the topic from previous levels and offer a refresher course. She also offers help with tests and will meet with students one-on-one to understand the material better and get better studying strategies because she wants her students to succeed. Victoria Yu, Clinical Education Assistant Professor, University of New Mexico, College of Nursing. Vicki knows what it's like to struggle through nursing school and is willing to share her experience with her students. She reminds them that they too will be successful nurses, and often reminds them that their failures will never define their achievements. Vicki does not want to make her class stressful for students and is always willing to find ways to help her students grow and learn. She brings guest speakers to her classes so that students have outside voices helping them through their studies. Vicki encourages students every day. They know she wants them to do well. She is also friendly to every student, and her students feel very comfortable when approaching her because she is an encouraging person. Clinical Partner Side Award recipient. Loveless Health System. The UNM College of Nursing has chosen Loveless Health Systems for our 2022 Clinical Partner Side Award due to their willingness to come to the table to discuss increased opportunities for clinical rotations, as well as for the increase in rotations they have already taken on in the past year. In 2021, Loveless hosted a total of 117 BSN and MSN students. In 2022, they expanded that number to 231 BSN and MSN students, a 97% increase in clinical rotations. Loveless and the College of Nursing are currently in talks about how to expand upon that number in future years with the addition of increased APRN rotations. In addition to increasing our student clinical rotation numbers, Loveless and the College of Nursing are also exploring an expanded partnership for an internship program slated to begin 2023, offering increased opportunities for our pre-licensure BSN students.